The data with denosumab was very exciting. We participated in the D-CARE trial, and so we waited for that. And I think we were a little bit surprised that it didn't show a benefit in either the primary endpoint, which was the bone metastasis-free survival or disease-free survival. And it really raised the question because the immediately preceding presentation was from our Austrian colleagues from the ABCSG18 trial that already showed benefit in 2014 in reduction of fractures. So I think that we saw with both of the trials, but differently now we saw the secondary endpoint from the Austrian trial that showed disease-free survival benefit. And so about, at 8 years, there's about a 3% benefit in disease-free survival, which was not seen in the D-CARE trial. I think the other interesting part was really looking at some of the side effects. And so in the D-CARE trial that had a very intensive denosumab administration schedule with monthly for the first 6 months and then every 3 months for 5 years, did have a high rate. And we see that osteonecrosis of the jaw does seem to be a time-dependent event. So the longer patients were on the trial, then the higher the incidence went. And they had about 122 events or 5%. So I think, that's always been a discussion point with patients when we talk about denosumab. Now in the Austrian group, they didn't have any. So they had some dental events, but no ONG events. And their schedule was every 6 months, something that we utilize as standard of care with patients that are on long-term aromatase inhibitors. And so I think looking at that partnership of data, I think we can feel very comfortable with the Q6-month schedule that I'm utilizing with AI therapy.